Hello everyone, and welcome. Today, we're going to talk about a part of your body that you might not be very familiar with, but is absolutely vital to your health and movement, your fascia. We'll explore what fascia is, why it's so important, and what happens when it's not at its best. Most importantly, we'll cover practical, step-by-step strategies you can use to support your fascia and improve your overall well-being. Just a quick disclaimer. The information in this presentation is for educational purposes only. It is not a substitute for professional medical advice. Always consult with your healthcare provider before making any changes to your diet, exercise routine, or medications. So, what exactly is fascia? It's a continuous network of connective tissue that runs throughout your entire body. You can think of it as a huge, intricate web. It's not just in one place, it's everywhere. It holds your muscles together, keeps your organs in place, and helps your nerves and blood vessels function properly. When it's healthy, fascia is supple, elastic, and slippery, allowing muscles and organs to glide smoothly past each other. When it becomes weak or sticky, that's when we start to feel issues. When fascia is not well supported, it can become stiff, rigid, or tangled. This can feel like chronic tightness or a deep ache that doesn't seem to go away with regular stretching. This stiffness can restrict your movement, making it harder to bend, twist, or reach. Over time, this can lead to more serious problems. The article mentions inguinal hernias, which are a failure of the fascia in the abdominal wall, and pelvic floor issues, which are often related to weakness in the facial support in that area. So, why does fascia weaken? It's often a combination of factors. Dehydration is a big one. Think of your fascia like a sponge. A dry sponge is stiff and brittle, while a wet one is soft and pliable. Poor nutrition and certain medications, like some diuretics, can also play a role by depleting the body of the nutrients and fluids needed to build and maintain healthy collagen. Additionally, a lack of movement, chronic stress, and simply getting older can all contribute to the breakdown or stiffness of your facial tissue. While everyone can benefit from good facial health, some groups need to be particularly mindful. Athletes are at risk due to the repetitive stress on their bodies. Gentle stretching and foam rolling are crucial for them. As we get older, our fascia naturally becomes less elastic, which can increase the risk of falls and reduce mobility. Low-impact exercises are key here. Hormonal changes during pregnancy and postpartum are also a major factor, as they can soften connective tissue. Targeted recovery strategies are very important after childbirth. Finally, people with genetic conditions that affect collagen, like Ehlers-Danlos syndrome, need to focus on gentle strengthening to provide as much support as possible for their system. Now, let's get to the recovery plan. The first and most foundational step is hydration. Again, think of your fascia as a sponge. You can't fix a stiff, dry sponge until you re-wet it. The same is true for your fascia. It's not just about drinking a lot of water at once, but consistently hydrating throughout the day. Also, adding electrolytes helps your cells actually absorb that water, so it's more effective. Don't forget that many foods are also great sources of water and nutrients. Fascia is made of collagen, so the next step is to provide your body with the building blocks it needs to repair and rebuild that tissue. Vitamin C is absolutely critical. Without it, your body can't properly cross-link and strengthen collagen fibers. The amino acids found in things like bone broth are the raw materials for collagen. And minerals like magnesium and potassium are key for proper muscle function and fluid distribution, which is directly related to your facial health. If you're on a diuretic, a healthcare professional might recommend specific supplementation, so it's always best to check with them. Fascia responds best to gentle, consistent motion, not forceful stretching. We want to encourage the tissue to glide and slide, not pull it to its breaking point. Exercises like Tai Chi, Qigong, and gentle yoga are excellent for this because they focus on slow, controlled movements that promote fluid exchange within the tissue. Tools like foam rollers and massage balls are also great for self-massage, but the key is to use light, sustained pressure, not to force a stretch. A word of caution: if you have a hernia or pelvic floor issues, activities with bouncing should be approached with extreme care and ideally under professional guidance. Sometimes, the fascia has been tight for so long that you need a little help to reset it. This is where professional manual therapies come in. These techniques, such as myofascial release, work by applying gentle pressure to encourage the fascia to soften and release. They can be incredibly effective at breaking up adhesions, improving fluid exchange, and restoring proper movement patterns. Finally, we can't forget about the mind-body connection. Your fascia is not just inert tissue, it's a sensory organ that is heavily influenced by your nervous system. When you are stressed, your nervous system can cause your fascia to tighten up as a protective mechanism. This is why getting enough quality sleep and managing your stress are so important. Deep sleep is when your body does most of its repair work, and practices like meditation and breath work can directly help release that stress-induced tension. Since the pelvic floor is a common area of facial weakness, it's worth a special mention. It's not just a set of muscles, it's a complex network of fascia and muscle. The first step to healing a dysfunctional pelvic floor is often not strengthening, but releasing the tension. Gentle exercises like diaphragmatic breathing, cat-cow, and happy baby pose are great for this. A word of caution about Kegels: they are not a one-size-fits-all solution. If your pelvic floor is already tight, Kegels can make things worse. It's often better to focus on relaxation first and then, if appropriate, add Kegels later with guidance from a physical therapist. Healing fascia is a process, and consistency is the most important factor. It's not an overnight fix. You'll likely notice some initial changes in a matter of days as you rehydrate, but deep tissue remodeling and rebuilding can take months. It's also crucial to know what to avoid. Things like aggressive stretching, processed foods, and sitting for too long can all undo the progress you're making. To wrap up, remember that your fascia is a living, dynamic tissue. Even if it's been weakened for a long time, it can be repaired and strengthened with the right approach. The 5 key principles: hydration, nutrition, gentle movement, manual therapies, and rest, are your guide.